Is that right?
We are rolling into ILAE.
So, what do you see as the role of ILAE in the global advancement of diet therapies?
I'm very excited to be a part of the International League Against Epilepsy Diet Task Force. I think this is the first time that we've had this opportunity to come together internationally and talk about treatments with ketogenic diets globally. And I think this is very important because I receive emails and correspondence from adults throughout the world with epilepsy or caring for someone who has epilepsy and are interested in ketogenic diet therapies. And the first question they ask me is, I live here, where is the closest center that has ketogenic diet therapies for adults? So what the ILAE task force has been very beneficial with regards to my interaction with them is finding out and learning what centers there are available, and then being able to communicate with patients and families and share that information. So we have brought together a section of the website that shows all of the different areas and all of the different centers that are treating primarily children, but now also beginning to treat adults with the ketogenic diet therapies. So I think that has been very important. Also on the website, there are recipes from different countries that are tremendously helpful. So patients that are already on these diets in different countries, perhaps with limited resources, can have more ideas. Trying to get the diet to areas of the world that really don't have a neurologist, a dietitian. They may just have a general family physician to be able to incorporate the diet into their treatment as well, also particularly in areas where medications for epilepsy are less abundant as well.
Where do you see the diet going globally? Where do you see it going?
I have been coming to the International Symposium since 2010, and each year I've been very excited to see that more and more centers globally and more individuals are getting involved with ketogenic diet therapies. More dietitians, neurologists, more adult neurologists, which of course is my area of interest, and also there are pharmacists here now and people in different disciplines that are also becoming involved. So I see in the future that this will continue to expand globally and become available, hopefully, to any patient with epilepsy that wants to be treated with a ketogenic diet or is appropriate for treatment with a ketogenic diet.
And what are the challenges you see in this kind of global expansion?
The major challenge I see in the global expansion is in educating patients, in educating physicians, and educating dietitians about the ketogenic diet, safety, about monitoring, and also having the resources to be able to do those things. There are some cultures and some communities that have very strong beliefs about foods and things that would need to be sort of overcome or really addressed and discussed in order for the ketogenic diet to be used effectively in those cultures. So I think that is something that we really need to focus on more.
Great. Is there anything that you would like to add?
Regarding the ILAE or?
Yeah, I should have asked that question before we switched over to ILAE.
Oh, okay.
But either way, either addressing ILAE or the earlier general questions or non-ILAE questions.
Sure. My hope as an adult neurologist is that ketogenic diet therapies will expand and become available worldwide to any adult that has epilepsy and also other appropriate neurologic disorders such as brain tumors, Alzheimer's disease, so that they have access to those therapies when they're necessary.
Okay. And I have one last question. So, and I've been asking, do we, in general, we talk about the diet for drug refractory epilepsy, and that's sort of that's a vague term, it seems. So when do you consider diet therapy with adults?
With regards to when I consider diet therapy for adult patients with epilepsy, when I first began the center, I was focusing just on adults that have drug-resistant epilepsy, and I define that to be having tried 2 anti-epileptic drugs that are appropriate for the seizure type that the patient has, and going to maximum tolerated doses and having that drug not work to control their seizures. I was focusing initially on treating those patients with ketogenic diet therapies, but I always learn from my patients, and I have had a group of patients that have come to me either having never been on a medication or having been on several and had terrible side effects and decided to stop their medications. And I have put some of those patients on the modified Atkins diet in particular because my belief is that treatment with diet is advantageous, is preferable to no treatment, and that's what I was faced with in those circumstances. There are no studies to support that in adults. We don't have evidence-based medicine to support it, but we have put together a collection of 10 patients that we've looked at in those circumstances, and have seen that they have done tremendously well with the diet. So the hope is in the future for those patients that either have extreme side effects or have other comorbidities that could be treated with the diet as well, that may be an option.
Kevin, do you have any?
No, I don't have anything. I think that was brilliant.
No.
Yeah,
Great.
all right,
Thank
sounds
you.
good.
Thank you.